a young woman who had a breast cancer discovered right at the tail end of pregnancy, and obviously going through truly one of life's greatest moments and one of life's worst moments at the same time. There's a lot of concerns besides just going through treatment and, of course, health of the child, and then issues about future fertility that become important. And that young woman did go through multiple rounds of chemotherapy. Child was fine. That was 13 years ago, and so we would venture to say that woman is cured of that breast cancer. She did go on to have other children, and so really this is sort of the best of all possible worlds, and really shows the hope that there is for patients going through cancer care.
It takes three things to treat cancer, three main items: surgery, chemotherapy, and radiation therapy. And radiation therapy is the most expensive part of that whole project. And so their commitment was to get started with radiation oncology, get started with the Radiation Therapy Center. And at that point in time, we did not have medical oncology, did not have a lot of surgical subspecialists, and the program has grown from there to where we have fantastic chemotherapy and many, many different surgical subspecialties.
You can't create a cancer program overnight, and what they have done is steadily recruited the various components of the total cancer care over the years, committing a large amount of resources to doing that. I mean, I can speak from experience, having been chief of staff over the previous 2 years, knowing full well the type of money that is being expended for new equipment and recruiting of new physicians so that we can provide those services for our patients and meet all their needs here in their own community.
The diagnostic technology has expanded to keep pace with the growth of the medical staff. The CAT scan technology, PET scanning technology, MRI, open MRI, nuclear medicine technology, all those things, both here at Villa Rica, all those resources have really expanded the capability of Tanner to provide cancer care to the whole West Georgia region.
Not only do we have all of the different physicians involved, the medical oncologists and the radiation oncologists and the surgeons, we have a whole team of allied health care professionals that are involved in taking care of these patients. We have nutritionalists, and we have nurse navigators, and we have spiritual advisors for some of the patients if they need that. We have behavioral health. We have many different people that are there to act on the oncology team.
The biggest, I think, advantage is in a smaller system, you really can make your connections with the other doctors and make a plan for that patient. From the primary care doctor on to the lung specialist, to the pathologist, to the radiologist, and to the oncologist and the radiation oncologist. Because we are a smaller system, I can pick up the phone and call any of them at any time and discuss the patient and discuss the biopsies or how to get the biopsy. So one of the advantages is in a smaller system, you know everyone, and you can really get the ball rolling a bit faster, get your results faster, in my experience.
The other thing that we do that is key is we have multidisciplinary tumor boards that meet and discuss patients from all aspects. We review their cases, we make recommendations, and that allows us to present the patient with a thought-out plan of how to treat their particular cancer.
In my first month that I was here, I had a patient whose primary care doctor found a lung mass. They called me and I saw him that afternoon. I was able to biopsy him the next day, and 2 days later when he returned to get the biopsy results, I called Dr. Bland from my office and he said send him over, and the patient had his first radiation treatment that day.
At the Cancer Center here in Carrollton, we don't believe in making patients wait. Patients are very anxious when they have a diagnosis of cancer. Anytime a referral comes in, we will see that patient the same day if we need to. We try to see everybody within 24 hours. It's not fair to the patients to make them wait. And actually, I think they get better care if you get them in earlier. You can start their treatment earlier, give the cancer less of a chance to spread. It's just better for everybody involved.
By bringing together all our disciplines in the same location, it is convenient to the patient because a diagnosis of cancer is hard enough. It's psychologically traumatic, physically traumatic. The patient doesn't want to be getting in their car, traveling to this other doctor, getting there, going somewhere else. So to have it all centralized in one place, I think is very important.
I think the community is really on board with what Tanner's doing. I think when I talk to people, they're very excited about the growth of the hospital in general, about the cancer center. I think most people would prefer to receive their care close to home, especially if they feel like that care is equal to or superior to what they can receive elsewhere, which definitely is.
A patient's outlook and attitude play a critical role in their outcomes. I mean, we've all seen over and over again patients who have a great attitude, and they do better than patients who aren't able to try to be positive and have hope.
I feel like I'm an ambassador for the program. I feel like I am a major source of support, a major source of comfort, because I can say, look at me, I'm almost 10 years out from my diagnosis. You can do this. I've been there, I've done it, and you can too, and you can do it better.
When a patient receives a cancer diagnosis, it's not just the patient that receives the diagnosis, it's the entire family and their entire support system that receives that. And so in taking care of the patient, you sometimes end up taking care of the family and the support people with the patient.
If you say the cancer word or the big C word, pretty much the patient doesn't hear anything else for the next several minutes. All they can think of is, am I going to die? And for this patient, there's a fair amount of emotional investment that goes into taking care of them. And you get to know these patients more in depth than your other patients. You spend more time with them, you see them more frequently. Not only do you see them and operate on them, but you then follow them every several months for the next several years to help make sure that they're doing well and that their cancer is gone and staying gone.
The navigator is one person that you can go to kind of pull the whole big picture together. You have lots of different physicians, tests, treatments. It's very overwhelming for the patient. So the navigator is one person that can help streamline the experience and be there to support the patient throughout the experience.
I had a patient with breast cancer who recently had a follow-up CT scan which showed a new spot in the middle of her chest, and we did some additional testing, and that testing turned out to prove that it was negative and that she did not have a recurrence. And I called her at night, and her whole family was there on the phone, and they were all crying, and it was just an intense emotional moment, and it's a privilege to be part of that.